Hello and good day. I'm delighted to welcome Professor Yap Seng Chong to Talking Philanthropy. Professor Chong is the Dean of the School of Medicine at the University of Singapore, and we're delighted to have him with us today. Professor Chong, let me begin by asking you what role philanthropy plays at your School of Medicine.
Good day, Kirsty. Thank you for that question. Philanthropy is central to the Yong School of Medicine. So our school was founded in 1905, so 116 years ago. And at that time, Singapore, of course, was a British colony, and there were no medical facilities for the local population. Most of it was provided for the British and the British Army. So in 1904, a local Chinese businessman called Tan Jiak Kim lobbied the colonial government to start a medical school. And the government said, okay, we will do it if you raise 87,000 pounds or dollars, I can't remember exactly. And there was a lot of money in those days. So, and he rallied the local business community. And within 3 months, they exceeded the funds, the amount that was raised, and basically that led to the founding of our medical school. It went through a series of name changes and finally sort of settled as the Faculty of Medicine, National University of Singapore. And then again in 2005, another donor came in and made a big gift of 100 million Singapore dollars this time in 2005. And that's why the name of the school was changed to the Yong School of Medicine, because the gift was from the Yong Trust. So philanthropy has had a major role in the naming of the school and in the funding of the school. So the first major gift led to the founding of the school. The second major gift enabled us to take a big leap in terms of our ambitions and our abilities with new buildings and new facilities.
Well, actually, that was going to lead on to my next question about where the money goes, and you've partly answered it. But I mean, how much of the money goes into research, for instance, philanthropic money?
Okay, so in general, about 60% of the money from donations goes into research. And this could be, quite traditionally where a grateful patient, for example, gives money for a particular cause, like or a very popular cause would be like children's cancer, for example, right? But in recent years, we've had more and more big gifts going towards a particular area. So last year, for example, we received a very generous gift of $30 million to give children the best start to life. And I'm talking about helping them, be born in the optimal condition, to have the early childhood development optimized, so that they can become the sort of the most productive people that they can be. So more and more of these gifts are coming up. But interestingly, I was looking through the records. In 1956, the Rockefeller Foundation actually made 2 gifts to the school. And one of them was for research in viral diseases, which of course is very current at the moment. But back in 1956, right, the Rockefeller Foundation made a generous gift of, I think, almost $250,000 US dollars to the school.
So would you say there's actually quite a long history in Asia of giving towards medical research, or is it something that we're seeing that's very much now on the increase?
I think in Asia, there's always been a great value placed on education. So a lot of the early gifts, traditional ones, have always been towards education. And in Singapore, where the government, very generously funds the universities, there's always a perception that maybe research should be funded by the government, and the public will give towards education instead. But I think that is changing quite nicely. So as I mentioned, in recent years, we're getting more and more interest in particular areas of research. So and I think that is a trend that we really, really welcome.
I was going to ask you next, where does most of the philanthropic support come from? You mentioned former patients, but where else?
Well, I think the majority of donations and gifts come from large foundations, large family foundations. These were usually set up by pioneers in Singapore. So famous foundations like the Lee Foundation, Shaw Foundation, and of course, I mentioned the Yong Trust, for example. So these are the ones that usually provide a majority of the large gifts. The grateful patients usually is a smaller proportion of the gifts, and of course we have alumni of the school who also give. But again, this is something that is still relatively small, and we are hoping to grow that by improving alumni relations and giving them better reasons to support the school.
And how has the School of Medicine supported the Singaporean government in the response to the pandemic? And to what extent has that response been enabled by philanthropy?
Okay, so I think the school has played a major role in a response to COVID-19. So obviously our staff, a lot of our faculty are staff in the hospital, the National University Hospital, and they take care of the COVID-19 patients, both in the intensive care units as well as the isolation wards. Our staff have also volunteered to go out to places where they're needed. So for example, in Singapore, we had a major outbreak in the migrant worker dormitories, and 500 of our hospital staff went out there to man stations in the dormitories to take care of the workers. Then we also have a BSL3 or Biosafety Level 3 laboratory, which is able to handle the coronavirus safely. And that has also provided services to the government to help deal with this virus. And on top of that, we have been very involved in educating the public. So we created two major initiatives. One was a cartoon series called the COVID-19 Chronicles. If you Google that, you will find that cartoon series. And that was designed as a public health education because one of our faculty members, Professor Dale Fisher, is actually chair of the Global Outbreak Alert and Response Network of the WHO. And so he was able to provide very authoritative advice through the cartoons. And we purposely used the cartoon because it was accessible and fun, and at the same time, we made sure it was accurate. Then we also launched a webinar series called COVID-19 Updates from Singapore that ran on a weekly basis, and that provided weekly epidemiological and updates, as well as speakers from all around the world, including the Director General of the WHO. So that went for many 24 weeks, and I think it provided a lot of information to a lot of people around the world, not just Singapore. And of course, finally, our researchers published over 300 articles on COVID-19 in the past year, and have been developing their own vaccines and monoclonal antibodies and prophylactic treatments for COVID-19. So yes, I think the school has participated quite a lot in our response to COVID-19.
I mean, it sounds like you've got great support from the Singaporean government, but do you think we'll see greater government support more generally, particularly within Asia, for philanthropy post the pandemic?
Yes, I think so. So during the COVID-19 year, the Singapore government came up with several budgets. Usually it's just one budget a year, but they actually came up with a few budgets incrementally to support Singaporeans and Singapore businesses and economy. And I think one of the things they are doing is to basically match or boost donations to social services because they understand that gifts will probably drop because of the economy, and they're going to enhance any gifts by matching it further. So I think the government is really doing their best to help the economy and the people of Singapore.
Now, the third UN Sustainable Development Goal is to ensure healthy lives and promote well-being for all ages. To what extent is research at the medical school connected to that development goal?
Well, the vision for the school is inspiring health for all. So we're very focused not on diseases alone, but also health. And to that extent, we have 9 research programs in the school, and 2 of them are very health focused. One is on human potential, which means basically to help individuals get the best start to life and to develop optimally. So we're looking at the effects of stress or distress in expectant mothers and the effects on a baby. We're looking at the early childhood environment, nutrition, health, stimulation for the child, so that they, to basically help them avoid learning issues, and then to see again, what health, what sort of eating behaviors would prevent childhood obesity and things like that. So we are doing that and going into adolescence and adulthood. And then we have another program called Healthy Longevity, which the main aim of that program is to extend the healthy lifespan of individuals, by as much as they can. So our big aim is to sort of extend healthy lifespan by another 5 years. So in Singapore, we have found the longest life expectancies at birth, around like 83, 84 years of life. But the healthy lifespan is about 74. So there's a 10-year gap. And we hope to maybe reduce that gap by 2-3 years and eventually 5 years. And that's our focus on health.
We've seen medical researchers all over the world really pull together in the past 12 months to battle the COVID-19 epidemic with fantastic results. But what research do you think is needed to prepare and respond to future health crises and indeed, for future pandemics?
That's a good question. So obviously, I think governments around the world are now going to pay a lot more attention to pandemic preparedness and also vaccine responses, being able to pivot and respond to any emerging infectious disease and to produce vaccines to prevent the disease. So certainly, I think vaccine research is one major area, but I think also boosting the epidemiological aspects of controlling epidemics. So contact tracing, quarantines, and enhancing safe measures, protective equipment. So I think those are things that are not so, I would say, interesting to a researcher traditionally, but I think that have obviously become very important with this experience of COVID-19. So, and of course, the usual traditional areas in infectious diseases, including the immune response and things like that. So, I think pandemic preparedness. And one more thing, I think coordination between agencies is something very important. Data sharing and coordination. So I think these are all things that we have to enhance to be prepared for the next big epidemic.
What future health crises keep you awake at night? What worries you the most? I don't know. Is it antibiotic resistance? Is it future pandemics? What are you most worried about when you get your crystal ball out?
Well, unfortunately, I'm not a worrier and I sleep very well most nights. So I'm fortunate that way. But yeah, all those things. I mean, obviously, antimicrobial resistance is very important. And I think the Wellcome Trust is actually sponsoring a network in Asia to look at that in particular. But I think in Singapore, the one condition we are most worried about is aging of the population. So like many Asian megacities, Singapore's fertility rate has dropped quite a lot. And as a result, the population is aging very fast. So at the moment, Singapore has 5 young people supporting every person over the age of 65. But in 10 years' time, there will only be 2 for every person over the age of 65. So it's a very fast change in the demographics. And that's what I think worries most people, most health authorities in Singapore. How are we going to take care of all these older people? And it's not just the healthcare authorities, but the economists as well. Who's going to provide a workforce? Who's going to be, doing the work, and who's going to pay for all the care that needs to be given? So I think this is probably the biggest issue I would worry about at this point in time. Aging.
And just And just finally, would you like to see more research done into philanthropy itself, into what makes people give, where the money goes, the impact, and so on?
Yes, I would. I think uh, our medical students and nursing students this year are all, I would call them post-millennials. I mean, there are people born around the year 2000 and beyond. So they are very different. And my staff, a lot of them are millennials. So, they think very differently from me. So what would incentivize them to give, or what would interest them in terms of donations? I think it's very different from my generation. So it'll be useful to know more about what uh, purposes would most speak to this newer generations. So I think in particular we should look at that. So obviously there are some trends like eco philanthropy, and so forth. So I think we should spend some time studying that.
It's interesting what you say about the new generation. I mean, would you say they've got more of a social conscience, that generation?
Oh, definitely. So yeah, I think people my generation are still fairly materialistic, right? So in Singapore we say the 5 Cs, car, cash, car, condominium, credit card, and country club, for example, right? So my children don't really worry about those things. So if you want to give them a nice designer handbag, they will sort of like, oh, no thanks. People my generation don't carry that kind of stuff, right? So I think they have a different values from us, and they value different things. And certainly their social consciousness is much more developed at their age than it was when I was their age, right? So I think they're different, and we have to be very aware of that in the way we teach them, what kind of jobs we offer them, and how we're going to get them to participate in social enterprises.
Well, that gives us all hope for the future, doesn't it? That generation.
Very much so.
Professor Chong, thank you very much for talking to us at Talking Philanthropy today.
Thank you. It was great talking to you, Kirsty.